Well, what's going on? How are you, Tammy?
I'm good, a little rushed, but I made it.
So, was there a surgery going on when you had to leave? Or
Yeah, so with our schedule with the holiday, I was trying to help out some of our staff and try to get some of our patients in because they were going to have a hard time getting here, possibly around the holiday and being out of town. But today is also our surgery day. So we had a couple of surgeries, and I've been running all day long. It's
yeah.
been one of those days.
So, since you're having to scrub in for surgeries, you're definitely not a professional, right?
No, not at all.
Not the least bit
It's
professional.
just a hobby, just a hobby.
What what is all this professional status thing that people have been talking about?
It's kinda crazy. I told my nurse, I was like, "I want you to know that I know that you're a professional." Um, but I think it has more to do with money than anything. I think the issues with, like, student loans, I think that's kind of been, like, a huge, outcry maybe. I don't know, outcry is a good term, but like a complaint maybe with, some people, they get student loans and then they have a hard time paying them back, or, they
or
are
refuse to pay them back.
Yeah.
yeah, or that. But, like and I'm not just talking about, like nurses at all. I'm just talking about student loans in general.
hmm
And I think that that was just kinda like one of the ways for, them to but when I say them, like the government to and federal funding to kinda limit the amount of funding that, people will be able to receive. So, like, nursing, Chris and I were talking about that this morning, by saying that they're not like a profession, then they are saying, "Okay, well, you now are falling out of availability to be able to have some of your student loans canceled if you do some of the programs where you go to, different underserved areas." So, some people would be able to have their student loans, forgiven if they went to underserved areas and worked for so
This has
many
been a thing
years.
for a while. If
Yeah.
if you in fact, one of the colleagues that we know in the dental field, did this. He went to a reservation and worked for a year or 2, something like that, and if you do that, your pay is less if you work in these areas, but at the end of that agreed upon time, your school tuition that you, had was paid for,
Mhm.
and then you go wherever you want to. However, that's a sacrifice that you make, in order to have your school paid for. It's a benefit for both sides. But
Yeah.
the problem with this is that, starting with the Biden administration, you know how a lot of school tuitions were forgiven.
hmm
All right. Now it's easy to say that they're forgiven. The schools already have their money. Teachers already have their money. Everybody involved already has their money, and that leaves, uh, Mr. and Mrs. John Q. Taxpayer, footing the bill, and that's what the problem is. The Department of Education has decided that they're going to limit who can receive postgraduate loans, that are forgivable, and that's what that's and I know that right now the emphasis is on the nurses, but it won't stop with them. It will go to
Mhm.
others.
Oh
You
yeah,
know,
for sure.
which you got to understand. I'll probably get pushback for this, and that's fine. I'm okay with this if you're going to say that certain loans we're going to forgive. Okay, all the all that this determination says is we're going to make you responsible for your bill and not someone else, and I'm okay with that.
Yeah.
Yeah, I mean, I don't, as Mister Mrs. John Q. Taxpayer, I don't feel like I should have to foot your bill.
Yeah.
You know, um,
I also feel like, though, if you're gonna limit who has the chance to having, like, your loans forgiven, I feel like the interest rate should be a little reasonable. Like, because when you talk about, like, professional schools, like PA school, medical school, you talk about, like, nurse practitioner school, all of those things, they're expensive.
Turns into a mortgage basically, or
Yeah.
worse.
Yeah, it's super. I mean, actually, my loans could potentially be more than our house note. So, like, that when you think about that, that's a lot, and if they could limit okay, fine, you're not going to forgive these loans anymore, but can you make it a reasonable interest rate, where it's more doable, more manageable?
Yeah, I kind of think that Tammy got in the wrong line. We missed the one where you get to have your loans forgiven. We don't know where that line is.
Yeah, I don't either. I'm usually like you were talking about Mr. John Q. Taxpayer or whatever. So,
And it's really, one of the sad things about this is that the people who there's a lot of people who deserve probably to have their loans forgiven if you're going to forgive loans. But if you don't make a certain amount, you're the one who gets your loans forgiven. If you've gotten behind on your loan, sometimes you can be forgiven. Those who make their payments on time, no, we're not going to forgive theirs.
yeah.
And it's just kind of backwards in determining who deserves to have their loan forgiven and who doesn't, to me. If you're going to say, here's the fair thing to do, to me. If you're going to forgive loans, everybody who's caught up, who's in a certain position and has not missed a payment, they get theirs forgiven first. To me, I mean, they're the ones who have made the sacrifice to do the right thing. They deserve to have their loans forgiven first. To me, they do.
Yeah. Well, I think a part of the bigger issue, just in my opinion, is that, we've sort of developed a culture of predatory lending. And I think it's been going on for quite some time. And not to mention, I could be wrong about this. I don't think I am, but my understanding is most public universities don't even have to pay taxes. So, and on top of that, from what I hear from others, the cost of tuition and these different college programs has shot up a lot over the last 5-10 years. So I think all of these things have kind of compounded, and then higher cost of living, higher mortgages, higher cost to purchase a vehicle,
inflation, lots of things.
Yeah, all these things are piling up on people, and wage growth is stagnant for the most part. So,
Well, I think kind of it would be better even if they would kind of change the way that they worded that to say that it's not considered like a professional program, because it is a professional program.
yeah,
Like it is. You're saying that, like, what, they go into nursing as a hobby? I mean, like,
Yeah.
like it's their job. It is a profession, and to say that it's probably one of the oldest professions, nursing, and for somebody to say, "I'm sorry, you're no longer a professional." Yeah, no.
Well, and at the end of the line,
witchcraft.
Yeah, like, what is that?
At the end of the day, I can see how that would discourage people who have received a degree in nursing from going on and getting postgraduate degree. If you can't afford it, I feel like you should be able to get a loan to do that. However, if they want to say that that's fine, as long as you take out this loan, you have to pay it back like everybody else in the world.
Yeah.
That should be the fair thing.
And a lot of people hate the idea of putting a cap on anything, but I sort of agree that something like that, the interest shouldn't just be whatever the business wants it to be, or they shouldn't be able to necessarily charge whatever high interest rate they want to charge. But to argue the opposite of the point that I just made, I also understand the investor standpoint, or somebody that's given the money for somebody to borrow, that they, you have to consider the amount of risk that you're taking. And so risk affects rates. If they feel like you're a high risk at not paying back, you're probably going to end up having a higher rate, and so on. So that factors into it some. But at the end of the day, at some point in our lives, we all need medical care. And so what happens if things get so expensive and out of control that now everywhere we're short on nurses and doctors, and
Sure.
we don't want to find ourselves in that position.
Well, the medical profession itself and the schools shouldn't care about this. They're getting their money anyway. That leaves only the government that would be holding the bag. And if the government, I would be, if you want to go into one of these professions that provides a service like that, I'm okay with providing interest-free loans if I'm the government.
Yeah.
If I'm getting my money back and that's what you're after, I would say, we're not going to forgive your loan, but we're going to give you this loan interest-free. That would be fair.
Yeah. Yeah. I mean, it could work. I don't know. I don't I don't know exactly what the best choice would be to fix that. So I'm not going to pretend like I do. But anyway, what would you say got you sort of on that path to where you knew you wanted to be?
Wanted to do medicine?
Mhm.
Well, I'm kind of like, like all kids, you start off, you're like, oh, I'm going to be a school teacher, like I feel like that's kind of like a common thing that little girls kind of think about and have your chalkboard and,
Mhm.
you teach your dolls. But, pretty early, I did all that, but pretty early on, I decided, like, just with my, grandparents being sick and, going to the hospital to visit people, I really, really enjoyed being there. Like, I that's kinda weird, but, I really, really enjoyed it, and, just in school, I always excelled in, like, math and science and wasn't real huge in, like, history or, I did fine in it, I didn't
Yeah.
do bad, but it wasn't, like, something that I was passionate about, and, I started looking into, I initially wanted to be a doctor, like, that's what I originally wanted to do, and, I actually something really strange, I actually looked at being a PA, when I was in, high school, my senior year, they always have, like, the career, like, find your career, and you have to go to the career center and look at what your profession would be. I don't know if y'all did that, but, we did, and I looked at being a PA, but the problem with being a PA at the time that I was looking, like, we didn't have practice laws in Mississippi until, like, April of 2000, and that's when I
Which
graduated.
describe that for us. What does that mean?
Okay, so, back in the 1970s, there were practice laws for PAs, so that means that the legislative, branch said, "Hey, you can practice here in our state," and, you're recognized as someone that can do that, and
Okay, describe that process as, what would we compare that to? Like, we all know that doctors can perform in any state.
Mhm.
Um, then what came along and could practice?
So I don't know that I understand your question, Chris, but like, so in order to practice in a state, like you have to have laws that say that you do. Like you had to have legislative laws that say you're acknowledged as a professional, you can practice here. And then so, like, you have nurse practitioners and you have,
That's what I mean.
yeah, you have nurse practitioners and you have PAs and you have doctors, and they're all, um, have practice laws. Okay. So, and I'm not huge into the politics of all of this, but I can give you kind of like an overview. And so at the time, we didn't have practice laws. So that means that in 2000, I could not, I could be a PA, anywhere, in the US, for the most part, except Mississippi. They didn't acknowledge us as a profession that could, you know, practice on people, like we
Huh.
were just like not allowed. Um, but back to my story. So like in the 70s, I think it was around 1972, 73. It's been a long time since professional development in PA school. But during that time, we could practice, and then there was the nursing lobbyers, I guess, would be the best way to term it. Like they, said, "Hey, these people shouldn't be able to practice here," and they allowed us
And
to.
it was strictly a politics move. They didn't want competition is what the deal was.
And so we were the people that were already practicing in the state. So there are some PAs that have been in the state, probably longer, or that actually did practice during that time frame because they were grandfathered in. But they were like, no more new PAs. And so, just like anything, you have to have people that lobby for you and all of that. And
Mhm.
so, when you think about how big, and I'm really kind of surprised, this is kind of back to what we were talking about earlier, and I'll get back. I'm really kind of surprised that they went straight for nursing, not being like the profession, because they are huge. Like the nursing, like powers that be, like with the nursing board and stuff, they're really big because, if you think about like a
Well,
PA.
you would think that the different organizations or the different sets of people in medicine wouldn't be fighting against each other.
Absolutely. Yeah.
That was my whole beef with it, was why would you wanna keep people
Yeah.
out of Mississippi from helping just because they were your competition, kinda?
Right. But I mean, what I was starting to say was like with the nursing board, like they're more powerful than you would think about like a PA. Because if you think the backing that the nursing board has, they have nurses, they have LPN, they have RNs, LPNs, nurse practitioners.
Mhm.
They have all of those people that are they're getting, they have more money. It's basically what I'm saying. You have more members, so you have more money.
Yeah.
And
It does seem like they picked one of the more powerful powerful
yeah.
groups to fight, so it's like,
Yeah.
okay.
And so, so that being said, like in order to, kind of keep your practice laws, at the time, we would have had to have people to lobby for us. And, that the PA profession has grown a lot, but,
But at that time, they were really small, very new, so they didn't have that structure that the nurses did.
right. And so anyway, so back in 2000, I, decided, okay, well, the PA thing sounds kind of great, but I don't think I would ever be able to, I'm going to stay in Mississippi. And so I was like, okay, med school it is. And so I just kind of followed that path. The story of how I went from from changing my mind from being like a doctor to being PA, it's kind of a long story. I don't know if you want to hear all that, but it's an interesting thing that God kind of walked me through, and I don't regret at all being a PA. I absolutely love my patients. They are precious and frustrating sometimes, and I'm sure they feel the same way about me. But I love taking care of patients, and I love surgery. Like surgery is one of the things that I never thought I would end up being in. Like when I started PA school and did, so PA school, you go like in Mississippi at Mississippi College, you go. It's a 30-month program. And so you go for 15 months, you do your didactic, and then for 15 months, you do like your clinicals. And
Okay, explain that.
Yeah.
so didactic means that you are going to be in the classroom. You are like, some people describe PA school like trying to get all the information in is like drinking from a fire hydrant.
Yeah.
You are like being
Bombarded with stuff.
yes, you are being slammed with all of this information. And so that's the first 15 months you're tortured. And then the next 15 months are a little more fun because you actually get to do your clinical rotations. And so in our program, you have to do like emergency medicine, you do family medicine, OBGYN, pediatrics. You kind of do like a little mini medical school like rotation, what you would think a third year medical student would do for their clinical rotations. And surgery is one of those. And I was like, I don't know how I'm going to do this. I mean, I'm not like squeamish, but I've also like never been in surgery before, so you have like your normal like first aid jitters, or, like, am I going to like pass out? Like, what's going to happen?
Yeah. I almost started to interrupt you a minute ago when you said you did it because you wanted to help people. I was like, that's a better answer than I want to cut people open.
Yeah, no, I don't want to cut people open, but surgery, like it's so rewarding in that, when you think about family medicine, which I love at the same time, but you're dealing with you're dealing with
Mhm.
chronic things like diabetes, high blood pressure, things that, they don't really have like a direct endpoint. Like if your patient loses weight or, their diabetes may get better, they may not have to be on diabetes medication, but, like there's only so far you can go with, trying to get that condition better. Well, if somebody comes in with like acute appendicitis, like sure, we can like zip them off to the OR, take out that appendix, and they feel great, Or you want to take out somebody's gallbladder, they're having gallbladder problems, to go in and take it out, and they're great.
My dad had his appendix removed. I think he was pretty young, and I don't know, it could have been the 70s or something, but he still has a huge gash, like, all the way
My
across
mom
his
does.
abdomen.
It's 6 or 8 inches long, and that's the difference in
Mhm.
um, the surgeries they had back then. And she spent 2 weeks in the hospital too, recovering
Yeah.
That was her
from that
gallbladder.
surgery. Yeah, and that was just and now people have these things done and they go home the same day.
Mm.
Yeah,
Speaking of which, do y'all ever use, like, robotic arm
we do. We do.
assisting
We
type
actually did
stuff?
some cases like that today.
Oh, okay, cool.
Yeah. So it's based.
Tammy runs the robot.
So it is. Dr. Jones actually runs the robot. I like exchange instruments out and stuff. But
Oh, well.
so the thing about, well, you wanted clarification, so I'm being specific. Um, but the robotic stuff, like some of our patients hear that and they're like, "Oh gosh, like really? Are you not going to be doing my surgery?" And
I
it's
would think it would be better because you don't have to worry about your hand shaking,
so like
around.
with like the robot, laparoscopic versus robotic surgery. If you think about a like a laparoscopic instrument, it's a straight instrument that has a mouth on it that you use. When you think about a robot, and the instruments that we use with it, they have wrist. So you're able to do um, different maneuvers easily. Like if I'm going to reach up and grab the inside lining of the abdominal wall, which is called the peritoneum, if I'm going to grab that and pull it down, I can do that a lot easier than trying to grab it with a straight stick where I can't like reach up, pinch it, and pull it down. If you think about sewing, so like we sew with sticks, and guys, that the surgeons do really well with that, but it makes the surgery a lot faster if they can have their wrist, and it's more like sewing with your hand than it is trying to sew with a stick, if that makes sense.
Yeah, a little bit. Um, so in other words, full range of motion
Yeah,
is what
yeah,
helps a lot.
yeah, and
Have you ever like talked to Dr. Jones as far as like whenever whenever he does his hand motions
mhm.
using is it how does he describe, is it pretty close uh to using his hands, or how different is it?
I think like they have like a thing that they like stick their fingers in, and so it's kind of like they're actually using their own wrist. They can to
Hmm.
move it, so it is
So it's
more.
pretty, like, if you get, I know there's probably some time it takes to get used to it, but I mean, your hand-eye stuff is pretty much like using your own hands
Well,
doing this?
if this helps, there are some people that, some older surgeons that were only doing open procedures. And there are some people that will go directly from um, doing only open procedures to doing robotic procedures because they have the skill required, I guess, is a little bit different than going from open procedures to laparoscopic procedures, like because you do have that more natural range of
So it may
motion.
be easier to get used to robot surgery than laparoscopic.
Hmm.
Okay.
Yeah,
I can't begin to imagine, and I know we haven't talked about this before, but the software and stuff that it takes to, and the programming to make those things manipulate just like
Your
the
own
surgeon
hands.
has to be incredible.
yeah, I think it's a very there's a lot of different robots out there. We use the Da Vinci, which is s- very nice. I like using those guys. It has 4 arms on it. Kind of looks like a huge spider. um, But it also they say that it due to the pivot points on those on the trocar, so what we actually put in the patient, whether we're doing it laparoscopically or robotically, is a trocar. So it is a little metal uh, cannula type, for better lack of better term. Does that make sense to y'all?
I don't know what that means.
So it's like a hollow straw.
I don't know what that means. Oh, okay.
Like, a straw is hollow, but it's just like a large straw that you kinda stick in, and it has a special cap on the top that keeps the gas inside the abdomen to keep it puffed up, and, that's what our instruments slide in and out of, and so, the robot, because it holds things in a specific motion and it only does certain motions, they say, when I say they, the people who market the robot say that the um, pain from surgery, even though there's not a whole lot from laparoscopic surgery, they say that it's supposed to be better. So I think the pain kind of is like where the trocar pain may not be as bad. I think that it just depends on how big your surgery is. Like if you're having this massive hernia repair, you're going to be sore. It's just going to happen.
Are there certain surgical procedures that you only use the robot for? Are there certain procedures that you only do laparoscopically?
Um, So our preference, there are people like within our own group that have moved from they used to do everything laparoscopic, now they do everything robotically.
So
Um,
is everything moving that direction?
I think so. I
So
do.
so pretty soon you'll have oh, well, let me ask it this way. Are there practices that only do robotic and not laparoscopic?
Um, I don't know that for sure. I'm sure there is out there somewhere. I mean, I'm sure, like I told you, like there's some people within our own practice that used to do
Is there anything that you cannot do robotically at your practice?
uh, uh, thyroids. I mean, we're not going to do like a thyroid uh laparoscopically, any kind of amputation, obviously, we wouldn't do that I meant we wouldn't do that, robotically. You see what I'm saying? There's always gonna be some things that, but we wouldn't do those laparoscopically either.
Yeah, well, if I guess what I'm asking is if your practice only wanted to do things robotically, would it keep you from doing anything that you do? I mean, as far as if they said no more laparoscopic, would it keep you from doing anything?
No, I mean, I think we would still be able to do all our colons, and that so basically you're saying, like, everything that we do laparoscopically, if they said, "You can't do it anymore, you have to do everything robotically," I can't think of anything right off, like, the top of my head. Um, I think
What's
So even though laparoscopic was a jump in technology, it's fading out, right?
Yeah, I mean, I would say I don't know, that would be
I
an
mean,
in
this was like going from cassette tape to CD. Now we're going to digital.
so you're asking me if laparoscopy is a dying art. It possibly so, because I know a lot of, like, the people coming out of, med school now that are surgeons, they probably have, they may have more experience on the robot because now the robot is more readily available.
Mhm.
So
now
they
that concerns me a little bit, just because I don't. I mean, I love that we can use robots, but I don't know. I guess it's the military side of me has a hard time being fully dependent on whatever the new thing is.
Well, I understand where you're coming from, but I always like try to explain to like the patients, it's not like a robot is doing the surgery.
Yeah, you're still
Dr.
manipulating.
Jones is still, making all the medical decisions. He's still using his own hands to do everything. It's just he's using a different instrument.
Yeah, my concern isn't so much whether the robot's doing it or the human's doing it. My concern is more if something happened to that technology and we no longer had it, you know,
Yeah, no.
and you have a bunch of surgeons that are like, I don't know how to use my
Now,
hands.
I think I'm, and I may be, Tammy may be able to correct me on this, but I believe that all of the physicians are still trained to do everything by hand.
Yeah, I would hope
But
so.
Yeah, to do it
right
open. Yeah, they do open procedures for sure. They're trained to do all of that.
now, what is interesting is I have seen a video, and I can probably bring it up for you sometime and send it to you. But I watched a doctor. This was specifically done on purpose, but I watched a doctor just for a brief amount of time perform a surgery using the robot, but he was in a state across the nation
I've heard of
as
that.
and he was like in the Northeast and performed it in Colorado
I'm
with the robot. So that was interesting.
yeah, I was gonna say I'm interested to know what kind of signal can allow for such vast. I mean,
Oh yeah,
that
I think that from a military standpoint, I think that they would be interested in developing that so that you could have a surgeon in one area be able to help out and
yeah.
yeah.
um,
Imagine if a surgeon here could perform surgery on a soldier in Afghanistan. I mean,
Yeah.
that would be
No,
incredible.
yeah, it makes me a cool capability would be. I know we've already got some, or at least in development, robots that are supposed to be able to do certain things on the battlefield, including even like a pack mule carrying supply type of thing. But it'd be cool if you could have some sort of off road robot that could, yeah, like deal with a sucking chest wound from a soldier that just got shot
Sure.
or something like that.
Or if you had a robot that was only programmed to do things like say that a field medic would do.
Yeah.
Or yeah,
We, you know, even in the little bit of training, well, I'm not gonna say a little bit. I did a pretty good bit of training, but even in my training as an or becoming an officer in the military, they made us. I forget. I can't even remember what the procedure is called now, but where you have to basically put a straw like thing in
like
somebody's.
trach somebody.
Yeah,
Yeah.
they made us like practice the trach thing. I think they taught us that and the sucking chest wound, how to deal with that, but um and a what do you call it?
tourniquet.
Tourniquet,
Yeah.
yeah. So I think we had to train on those 3 things, but as you can see, I forgot them. I no longer remember how to do any of that stuff, but yeah.
You know, it would really it would behoove everyone to at least, and I'm behind on it myself, but if you took a course every once in a while, every few years on basic, CPR, first aid, that kind of thing, because you forget those things, just like you said. I mean, I know you've been through the training, but if you don't stay up on those things, you forget. You do.
Yeah. Even CPR, like I've
Because
done
it could save a family member's life very
Oh, yeah.
easily. And
I've done CPR, or I've been CPR certified several times, and yeah, it's like if you don't do it, next thing you know, I mean, you remember rough things, but you don't remember specifics.
that's
you
right.
know?
And
And
honestly,
specifics are important.
well, I mean,
So-
honestly, remembering like the rough things and like remembering like the chest compressions and remembering the
Staying
breaths.
alive.
Yeah. And getting it like circulation, like just remembering the basics is good. It's better than nothing. So
They
yeah.
taught us to do it to the beat of staying alive.
That's right.
Mhm.
That's right.
Whatever works, I guess. So, and speaking of that term, let's say it again.
Laparoscopy?
I can't say it. Where did that term come from, or do you know?
I don't. I know that like the scope itself is called a laparoscope.
Laparoscope.
And I don't know if that
Well, I
has.
think that's where the term came from.
Well, but I mean, like, did it come from a guy's name? Back when all this stuff
Yeah.
was like coming around. Like, did it come from someone's name?
The reason I was asking was I wondered because that's the term that describes using your hands for surgery, right? Or
What, laparoscopy?
or when we were talking about robot.
Oh
Versus
yeah. That is
laparoscopic.
your actual yes.
Yeah.
That's using the little instruments physically in your hand.
Yeah.
Yeah.
I was just wondering why that specific term was used to describe holding them in your hand as opposed to
Just guessing, I would say that was probably somebody's
Named
name that
after
came
somebody.
up with
Yeah.
it, but because that's generally the way everything starts off.
Dr. Lapros, whatever. I don't know why I can't say that word, but
The term laparoscopy was coined by
Laparoscopy.
George Kelling in 1901, though he initially used the term cilioscopy to describe his procedure. The word itself was derived from Greek words lapara, meaning abdomen or flank, and scopy, meaning to examine.
Yeah, it seems like it's always Latin or Greek.
That's
Okay.
right.
Um,
And that you think about that, he coined that term in 1901.
But
It's
it hey
125 years
back
ago.
when
but look at when, they actually started using laparoscopy. I mean, that the actual what we think of as, laparoscopy now, I don't think started until what, the
Let's see here.
it's funny to me how, like, especially hundreds of years ago, you can have some super smart guy like that, but then right next to him, here's a guy that doesn't even know how to read. Like, I wonder how much, I don't know, 200 years ago, 300 years ago, how much of the population couldn't even read on a
Yeah.
basic level. But
Yeah. Then you have, like, the pioneers that
yeah,
go out there.
geniuses.
Yeah. Yeah.
I wanna see a clip from several hundred years ago where a doctor's talking to a regular dude that doesn't know how to read and trying to explain look,
But, I mean, you also have to
I
think
still can't say
but
it.
you also have to think that way back then, they didn't think about there being germs or anything
Yeah.
like that.
Didn't know
So
about bacteria.
yeah, and so, like, they didn't wash their hands, they didn't have, like, sterile technique or anything like that. They were
Yeah.
just, going
Going in
on
there with bloody hands and
Yeah.
somebody else's blood.
Or, like, even
Bloodborne pathogens, I guess they wouldn't have known about
The
either.
first laparoscopic surgery was performed on dogs in 1901, and the first humans were in 1910.
Really? I wouldn't have thought that because I mean, that wasn't really taught, in
And
medical
also,
school
I'm
for a
kind
while.
of curious as to because the term describes a tube being put in and using a light and a camera. Well, I know they weren't using a camera in 1910, so I don't know. I don't know.
Yeah, I don't know on that.
Well, I mean, if you think about, like, the first stethoscope, we have, like, long stethoscopes now. Like, before, they were, like, laying,
Yeah,
really
maybe
close
they
to
were
people's
using
chest.
maybe they were using some type of maybe lesser power microscope or something to.
Maybe.
Yeah,
Interesting though. This has been over 100 years since the first laparoscopic surgery. It's about time they came up with robots
Yeah.
after that.
I don't know if I saw something on the History Channel or what it was, but I feel like I remember seeing something about like one of the first discoveries of a human diagram of anatomy and physiology was in the Middle East, like 1,000 or more years ago. I mean,
That's crazy. Yeah.
Well, like, in Rome, they would do, I don't know if I'm gonna say this right, but vivisection. But um so it was against the law for you to be able to do anything to a dead body, to be able to look at it. So cadavers in our time couldn't use those. So
Mhm.
like they would take people out of the arena and like that were,
Grievously injured or
yeah, and
severely.
they would, as long as they were alive, they could cut them open and look at their organs.
Gosh,
So, like that,
so glad I missed that period.
so, that time frame or that period of time when they're learning all that stuff, they were learning on live patients, right before they died.
And
Working
shortly
on
after they started that, they came up with anesthesiology.
working on Maximus Decimus.
That's right.
Yeah.
Yeah, that I just the thought of how people used to just not think anything about fighting with swords and maces and
I'll tell you an interesting story. And, we just talked about, in the same vein of robotic surgery and that kind of thing. On one of my most recent visits with my dentist, he's telling me that one of the training sessions he went to for they always have to have, what do you call that? Where you do the learning every year?
Oh, continuing education.
Continuing education.
CPUs.
That's right.
something like that.
Mm-hmm.
And that they have robots now that do an entire root canal by themselves without any input from the dentist at all.
Hmm.
Those kind of things are coming as well.
Yeah.
They're in fact, they're mixing robots with AI, that kind of thing. to perform those. Some of the minor procedures like that, actually, that I know that doesn't, root canal doesn't sound like a minor procedure, but in the big scheme of things, it is. That they're totally done by a robot now without any input from the dentist.
Hmm. Yeah, it's interesting that they're that capable now, for sure.
And
And
you
I
would hope that if they're able to do that, that it also cuts down on maybe pain and
Yeah.
and mistakes, that kind of thing.
Chris mentioning, the root canal thing earlier, I was saying that I remember I was in corrections for a little while, and I remember one time when an inmate had to get a root canal done, and I swear, like, I can't remember it fully, but I swear they had, like, something that looked like pliers, and they were just snatching his mouth around, and he was, like, out cold, but I remember he woke up and he was like, "Man, my face really hurts," and I was like, "I wonder why." But
It should.
I have images of, like, the dentist just, like, tugging at him with, like, a pair of pliers or something. I don't
And I told Kevin, I was like, "That doesn't sound right. Root
No,
canal doesn't go that way."
yeah, that's why I'm like, I'm wondering if this is something that I think I remember and didn't really happen or what, but I know for sure that when he woke up, he was like, "Man, this hurts," and I was like, "Yeah, I bet it does."
Well, a lot of times,
Um,
like, just the injections, the numbing medicine makes your mouth sore, for
yeah,
sure.
yeah, but,
Yeah, but any kind of trauma like that, regardless of where it is in your body, if there's uh, a lot of movement on flesh, that kind of thing, there's going to be a lot of irritation, swelling, that kind
yeah,
of thing.
yeah, that's true, but I don't know, I remember that being rough in my
I
mind.
think it was more traumatic for Kevin than it was than it was the
Well,
patient.
maybe that was part of it that I had never, when you're the patient and you don't really,
Know what's going on.
yeah, you don't see with a bird's eye view, like if you're actually watching somebody
I tell you what, that's one of the
get it
things, and
done.
I've talked to Tammy about that before too, that, some of those things, and it's because of the anesthesia, it's because of the deadening, it's because of those kind of things that are utilized, and they get in such a routine of doing things a certain way. Some of the stuff actually looks rough. I would ask Tammy sometimes when some videos would come up, it's like, "Why aren't they being more tender right here? Why are they doing things this way?" But,
Oh, we have PA students and med students that, will come and rotate with us, and, like, when we're, done with the surgery and we're cleaning them up and, we're gonna sew them up and stuff, and, we've got everything sewn up and the dressing, we're getting cleaning them up, put the dressing on, and it's so funny because it always happens. Like, the students just, like, really gentle with, like, cleaning the abdomen. I'm like, "Hey, we got anesthesia for that. Get them clean. Make sure you get them all cleaned up and everything looks good. Get all the stuff off of them because, I mean, that's just what you wanna do.
so
That's like
Tammy's
your
the reason your stomach hurts when you come
That
out of
is
there.
not true. I am the reason your stomach is clean.
Um, Another thing we were talking about earlier is Tammy was telling us that nurse practitioners are much more qualified than PAs.
Our training is different. It's just different.
Yeah.
Um,
Has there always been like a little bit of a rivalry type deal going on there?
I don't really think of, I
There
mean,
would not have been a rivalry if it hadn't been for the nurses.
no, there's
Yeah.
not really a rivalry. Chris and I always joke around like that because he knows about the practice laws and he's like, "Wow," and so it's just kind of been something that, that we joke about. But I work with nurse practitioners and PAs in our practice, and I think they both professions do a great job.
Don't backpedal now.
I'm not. I'm not. I'm fixing to tell
I'm
you.
just, I'm just
Our training is different though.
yeah.
Nurse practitioners have are able to work a lot of times during their training. We can't. We are definitely
Y'all have to complete every step, which I would think makes sense because surgery. I mean, I'm a layman, but seems pretty serious. Like you should.
Well, I mean, we're just a little bit different. So we're a little
Yeah.
different in the way that we're trained. So we are trained. So when I graduate, I have my master's in medicine. Okay. And when nurse practitioners come out of school, they have either their doctorate in like their nursing studies and they have a couple of different degrees that I'm not like totally familiar with, but it's not, their background is a little bit different than ours. Where we have, we have go through sometimes we use some of the same textbooks that the med students have used. And when the PA program was being established in Mississippi, we actually went to UMC, and they like some of our classes were taught there with some of the professors that taught some of the medical school stuff. It was very kind of them to do that for us while we were trying to get the program going. But now everything I think is done at Mississippi College.
Yeah, and another thing people sometimes do is like and subscribe to the
That's right.
YouTube channel. I had to remind myself to say that. No, but if you enjoy the content, that helps us out a lot. Leave a comment, even if it's something nasty. Well, don't be too don't be graphically nasty, but yeah.
You can tell us about your surgery. I mean,
what do you mean, my surgery?
No, he's talking about the comments.
The comments that can tell us about their surgery.
Yeah.
Tell us about your experiences with either nurse practitioners or PAs.
Yeah.
Yeah, I think they're both are very good. And you can get a good one and you can get a bad one. It's all about the person's personality too, and
Okay, so tell us real quick, your experience with doctors who've worked with both. Which ones would they rather work with?
I think that some of the physicians that I've worked with, and even when I was in PA school and I would not shadow, but be doing my clinical rotations with them, they like that our license is through the medical board. So it's a little bit easier for them, where like the nurse practitioners have their license through like the nursing board.
I was gonna say too, like why are there two separate entities? It'd be too much on one, probably.
I don't know. We're just too different. We're set up differently. So, like the PAs actually came from the military. So they were actually seamen that were trained to do like by physicians to do certain procedures, and that's actually where the PA profession came from. Was actually, so they're just from different backgrounds is basically why it is the way that it is. It's just two different things.
So PAs initially came from military demands. Is that what you're saying? That's interesting.
Yeah.
Huh. Yeah. I don't know what all training, like I was Army, not Navy, but I don't know if Army guys, Navy guys, airmen all receive the same medical training if they're, in the medic classification or, I don't know, but I expect that they're pretty highly trained, or I figured they were pretty well trained because I don't know, to me, I'm sure there are plenty of difficult things that you can deal with, but having to deal with a sudden really bad injury in the middle of a battle would be, to me, not a nightmare scenario, or that's, I don't know. Seems like it'd be a lot to deal with. But a lot of those guys seem to handle it pretty well. I've seen some jokes about how medics try to act like things aren't as bad as they are. Like he'll be holding the guy's, arm that fell off and be like, "Man, you're okay. You'll be fine."
What are some frustrations that you have as a provider with patients?
Probably the most frustrating thing is like you set up a plan, like you talk to the patient, tell them, okay, this is what we're going to do, and you set the plan up, and then they come back to see you to see if the plan has been executed, and it's not executed. It's not been executed. And there's a lot of different things that kind of can go into that. Is it their understanding? Like I may feel like I'm communicating with them, but maybe I try not to use terms that are like medicine-y terms, like
You're not being too complicated. If you say quit eating this type of stuff and they don't, there's no misunderstanding that.
But I think that sometimes people don't understand the ramifications of what this particular food group can do to my blood sugar versus this food group can do to my blood sugar. Like I think that
And the people just can't stay away from the vegetables, can they? They can't stay away from.
What would you say? I have a feeling on what they're going to be, but if you had to pick two of the absolute worst, what would you say are the two worst?
worst what?
In terms of food,
Food?
Yeah.
I mean, I feel like tons of processed sugars
Number
and
one.
things like
Sugar, I
that
knew it was
would
going to be
be
sugar.
would
Yeah.
be like probably the absolute worst thing for you. But everything like in moderation, like just to treat yourself here and there is okay. But like I find that it's hard for people to have moderation. Like I was talking
Yeah,
to,
it is.
and it's not just in because I also deal with like wounds and stuff, and so it's not just in foods that you would think like eating. It's also like in activity. Like if I tell somebody you need to stay off your foot, like and it's like there's some people that can. They're a caretaker of
Mhm.
somebody and they can't stay off their foot. So I try to give them the tools that I can to help them. But then, I'm like, okay, well, you need to wear this particular thing. If you have to be up on your foot, I want you to wear this offloading boot for me. And then they come back to clinic in a regular shoe,
Yeah.
like, well, okay, we can't, that's not offloading the pressure. We've got to keep the pressure off that ulcer so it will get better. And sometimes, it's hard for people to do that. I mean, I know that, but it can also be frustrating because like our goal together is to get this well. And I know that if you can't keep the pressure off of that and you can't keep your blood sugars under control, that we're going to have a really hard time healing that
So
up.
what you're saying is that people come to you and they say, this is the way I'm going to live my life. I'm not going to change this. So what do I need to do to get better knowing what you know about me?
Well, I kind of feel like that's our society in general.
Mhm.
Like
People don't want to be told to do something that they don't want to do, or
well,
That's right.
it's not just that. Like you want the easy button. Like
Yeah.
everybody wants the easy button.
Easy and fast.
Yeah.
Yeah.
And so sometimes in wound healing, like it's not fast. Like it takes some time.
Mhm.
But I mean that's in anything. That's in weight loss, that's in just healing in general, like getting over things.
Wait, people have to be disciplined?
I mean,
Oh,
it's
there'll
Yeah.
be none of that.
our society reminds me of a book I had to read in college, Brave New World,
Yeah.
where they like have a pill for everything. I feel like that's kind of what people want. Like they want to have I mean, I get it. Like I want to eat ice cream and still be skinny, but like I can't have it every meal,
Yeah.
like that's not an option. And
Wait,
so
what?
I know,
You
right?
can't?
Can't have red velvet cake either.
Oh, no, you stepped across the line.
Yeah, I was gonna say ice cream's a deal breaker. Sorry.
But like that's what we want. Like we are a society that is driven by, what can I get out of it and like how easy can it be? Like I don't want to have to put any work into it.
This isn't. I don't know that there's any medical examples in this, but have either of you ever seen the movie Idiocracy?
Mm-mm.
Yeah.
You've seen it? I'm trying to think of.
It's one of the worst movies I've ever seen.
You didn't think it was funny? I thought it was pretty funny. But it's basically making fun of a lot of things that, in my view, are happening in the world right now. Like, there's one point where somebody that's serving in office gets like sponsored by Gatorade or something, and he starts telling everybody that the solution to everything is to drink Gatorade and like pour Gatorade on your crops and stuff.
And then they wonder why there's a drought.
Yeah. But it's like, basically a play on capitalism gone wrong type of thing. But I thought it was pretty funny. But yeah, I don't know what I was leading into with that. But, so sugar, and then I guess everybody talks bad about carbs. I know you need some carbs. So.
Carbs aren't bad. Carbs can be bad if they're like simple carbs that are going to turn into sugars pretty quickly and you're a diabetic. But if you are but if you're like a marathon runner, then you need those simple sugars that are going to turn into energy pretty fast so you can complete what you're doing. So, a lot of that is based off of what your goal is and what your malady is, I guess. So it's not that anything is bad, like particularly like potatoes aren't bad, but if I'm a diabetic, those potatoes are bad for me because they're going to be just like eating ice cream, right? And so you need the fiber that's in there to kind of make them more of a complex carb that will make digestion slower and you not have spikes in your glucose levels.
And some of those things would be, I've never practiced medicine, nor am I ever going to, but that some of those things would be frustrating to me in that her practice deals with people every year that continue to lose parts of their body to diabetes that has to be cut off because they won't change their habits. And apparently they're okay with that.
Well, I mean,
now I've never had to deal with some kind of addiction, that kind of thing. Her hospital also deals with patients every year that burn themselves because they're on oxygen, but they're going to continue to smoke cigarettes.
Ooh.
So, I mean, they have to deal with that every year because somebody does that. And the oxygen blows up. And
I shouldn't laugh at that, but I don't know.
It's like
cartoonish.
But I mean, but that's how addicted they are to the thing and unwilling to change that they are. And you think, how can I help this person?
Yeah, smoking in that situation reminds me of somebody smoking next to a gas pump or something. It's just like,
I mean, they have patients literally. They have patients that know that they can't smoke on cigarette, can't smoke a cigarette on hospital property. They will get their little IV, walk it downstairs, walk out into the middle of the road so they can smoke a cigarette and walk back to their room. I mean, that's the kind of addiction you're dealing with.
Oh yeah. Yeah. People.
And like addictions are like a lot of times people think about, oh, well, this is legal for me to do, whether that may be marijuana or alcohol or nicotine or food for even, I mean, like, food is an addiction as well. And, I find that you have to like apply. I mean, I can't walk into a 2-pack a day smoker and expect them to like come back and see me in 2 weeks and have stopped smoking. You got to like give them a measure of grace and encourage them and like celebrate your victory, like celebrate their victory with them,
But I feel like at the same time, they should at least be making an effort to either cut down or get to the point to where they can quit.
Yeah. I mean, it would be nice, but I mean, I'm not gonna, look at somebody that has a horrible wound and tell them I'm not going to help them. I will help them, but we'll also have an earnest conversation. I'm going to tell them, hey, look, like I can only do so much. This is what we're working with. If you're okay with this, then this is what we'll do.
And this is what's going to happen if you continue down this road.
Right. Yeah. And like, there's only so much that can be done. And they understand that, I feel like, to a certain extent, until sometimes we've walked down that road a little bit too far, at that point, and they're like, oh, you really meant that. I was like, well, yeah, I'm not gonna lie to you. Like I'm always gonna tell you the truth, and I tell that to my patients too.
I just wanted you not to be able to have something that you like.
Well, then there's also so we've talked about the bad side of things, right? So I also have to like celebrate the good side. So I also have patients that they do take me seriously and they're like, losing that one toe or, having that first diabetic ulcer, and I've never had one before. And then it took a while to get well, I have my patients that, they get the little glucometer and that is always, that they change it, I think every week. And it shows on their phone what their glucose levels are. And like, that's a huge tool that I have found that, which I don't manage their diabetes, but I found that when their endocrinologist or their primary care doctor actually hooks them up with that particular thing. And I'll even tell them, like, ask your primary care doctor, ask your endocrinologist about this and see if you qualify. You may or may not, but they can help you. But when they get that, um, they're I find that because they don't have to stick themselves and they can look down at their phone or their phone will alert them of, oh, my blood sugar's high or, oh, it's getting low. Like it really helps them kind of bring their A1C number down.
You mean rather than guessing? I'm just kidding.
Well, I have some patients that just don't check their glucose at all, so.
Yeah, see, if you don't know, it's not going to hurt you.
Yes, but
Yeah, what you don't know, Kenner.
Yeah, that's right.
But, like it does help them. And so they do good. And then I have some patients that quit smoking and their wounds get better and they go on and they live their life of, even though they may be an amputee, they're up walking around with their prosthetic. And so like there are people that, that do overcome. And I think that, you need to, or I need to let my patients know, hey, this can be done, and when it's so, I may cry about this. I'm trying not to, because I feel sorry for him. But when you do have a patient that you have to go in a room and you have to tell them, hey, I'm sorry, but your whole foot is
Oof.
is just messed up. You can't. You're not going to be able to walk on that. And it's not going to get better even with antibiotics. Antibiotics doesn't fix everything. You can only go so far. And they kind of have to come to that realization that, okay, I've been sick. This is making me sick. It's not just, I don't just have a wound on my foot anymore. I have an infection that's making me sick. And you have to tell them, hey, I'm sorry, but we're going to have to think about cutting your leg off,
Yeah.
and, you have these patients that are like, man, I just don't want to live then. And I'm like, no, 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 no. You are more than a leg. Like
Yeah.
everybody wants to leave with the parts that God sent them here with, right? Nobody wants to lose anything, but you are more to your family and to the people that love you than a leg.
Mhm.
And during COVID, we had some patients that got really sick and with COVID, and they had to be on a lot of pressors. And sometimes the side effect of being on medications that help to raise your blood pressure to keep you alive, it causes vasoconstriction, and it can cause people to get dry gangrene of their extremities, whether that's their hands or their feet. And but I've had some people that ended up like maybe losing both of their extremities, both of their legs and lower extremities, and they're up walking around, and like having those people that are able to come in because the some of the like Buckners and Methodist Rehab, they have people that are amputees that go and talk to patients and encourage them. It's easy for a girl that has two legs to tell you that you're more than losing a limb. Like you're going to be okay. But when you have somebody else that comes in that's a double amputee, or you have somebody come in that is going to, face the same stuff that you've gone through, it really is an encouragement to them.
And it's kind of strange to me that, and again, I'm not knocking these people that have that attitude that you talk about, but it's strange to me that you have people who, uh, like you said, they're either going to lose part of their leg or something like that, and they think they would rather not live. That's just so foreign to me as far as, and it's different mindsets for different people. I get that. That certain things affect, people differently than others, but I can't ever see reaching that point to where now you could tell me, and I say I could, it's not happening to me, but I feel like I could say, you could tell me I'm gonna lose my left leg there from my knee down, and I'll be all right. I won't like it,
Yeah.
but I'm gonna be okay. I can't see you reaching that point where you're like, oh, well, if I can't have my leg, I don't want to live. It just seems so foreign to me.
Yeah,
Right.
not in the modern day. I wouldn't, and that, well, I mean, even you know, I don't know, 300, 400, 500 years ago when you know you're going to be awake and they're going to be
I
using
mean,
a
the old sea guys used
hacksaw
to
or
have their
something.
old peg legs, you
Yeah.
know? I mean, goodness.
No, it's hard. It's a life-changing thing because
Yeah, it's
you go from in the beginning, being dependent on somebody to help you.
mhm.
Like it's hard. It's a huge adjustment,
Yeah.
and it's something that it takes a lot of strength to overcome, both like emotional and physical strength. It's a lot. I mean, because you've got to think about, like right now, if you wanted to get up and go to the bathroom, you just get up and go to the bathroom.
Mhm.
Well, then you've got people who can't get up to go to the bathroom on their own, and they rely on somebody else to have to come and clean them up or to try to help them get to the bathroom.
Yeah, that one thing in particular would really annoy me, the bathroom thing or having to have assistants go into the bathroom or shower or whatever.
Yeah, it's hard.
That
It,
would
it's a
annoy me.
it is hard. It's not something that's easy, but it is something that is doable, and it's something that you can go on to live a full life even after having to go through something like that.
Yeah, and I don't know in the modern day if they're, how affordable they are or whatever, but it seems like we have pretty good technology now to where, and obviously, yeah, you want to have your natural leg, but it seems like there's a lot of good, I don't know, robotic legs or replacements nowadays. But
Th-
And she also has to tell people sometimes, um, once they have a surgery and you can only remove so much like colon, that kind of thing, before you have to wear a colostomy bag.
Well, no. So,
And
no, you can that's not what causes you to have a colostomy. Because I mean, there's some people that you can hook their small bowel directly their, um to their rectum. You're gonna have a lot more frequent bowel movements, and you may not wanna live like that, and you may prefer to have, like, an ileostomy. But, you can't remove a lot of, small bowel, because you can get short gut, and then you'll be reliant on other nutritional sources. But you can, have people who have, like, cancers, like rectal cancer that would require you to have, a colostomy because you would
now
have to
that would
take
be
that part
difficult.
out.
I feel like that would be difficult.
yeah,
Yeah.
I mean, I'm not going to say I would rather deal with an amputation than that, but to me, the colostomy thing seems, I don't know, pretty bad. Like that doesn't,
People do well. There's videos online that shows you how to, pouch your colostomy for going to the beach, to pouch your
hmm,
colostomy or ileostomy for going to prom. Like there's a lot of people out there that do well with it. Like
yeah.
you
No,
adjust.
I mean, I think I've even known one or two people with one. Uh, I don't know if I've found out maybe by accident their shirt came up or something, but because it's like on your abdomen
Hmm.
basically or something, isn't it?
Yeah. And people
Yeah.
do well with it. They do a lot.
They definitely seem like they can move around and do
Hmm.
everything just like a
But
normal
that to
person
me
can.
seems like it would be a huge adjustment.
Yeah.
Uh, you know,
Yeah, I don't know. Maybe it's just the idea of having an exterior thing that could be punctured or something. But
I
then
know.
again, the human body's fragile anyway.
Well,
So
yeah, you have a lot of people that have like, like they have embarrassing situations, with that. And, but at the same time, they beat cancer. So,
yeah.
like,
Yeah, you're always
they're a
better.
survivor. They're
Yeah.
doing it.
Yeah, you're better off being alive in every case than
Yeah, and yeah, like I said, and I tell my patients this too, like, 'cause when you have diverticular disease, depending on the situation, sometimes you may have to have a temporary colostomy for a little while. And I always tell my patients, I'm like, nobody is in line, like raising their hand, going, "Ooh, sign me up. That is what I want." But you can do it. Like you can do it. You can get through it, and you can live a full life. And it's not something that has to limit you. Like you only are limited by like your own mindset in
mhm.
that standpoint. Like I said,
so why don't you, if we haven't done this already, we haven't talked about who she is, right?
I don't think so.
Why don't you
Yeah.
go ahead and explain to people who you are so they don't think that I'm talking to y'all weird and stuff?
oh, well, I'm Tammy Davis. I am Chris's wife. I am a physician assistant at Central Surgical Associates. I've been there this January, will be 10 years that I've been there. I work with Matthew Jones. He is a surgeon there. And we do laparoscopic, robotic, and open cases. We do hernia repairs and do any kind of colon surgery, cancer surgeries. And we do breast surgery as well. And I do wound care on Wednesdays.
And her doctor, even though he went to University of Tennessee, graduated from Ole Miss Medical
Oh, okay.
School. So there's that.
He went to University of Tennessee for his surgery training, his
So does he
residency.
say hotty toddy or is he a volunteer?
You know,
Because if he claims to be a volunteer, then boo.
yeah, I know.
No,
I
I'm just-
know. We may not need to ask that question. I don't know.
I would say he was an Ole Miss fan.
Okay, well, that's better.
All right, we like him. Yeah, that's funny. Shoot, I was gonna ask you. Trying to think of what I was about
What
to
was I know what's the hardest thing? I mean, other than the obvious, you know, I guess loss of life. What's the hardest thing that you've had to deal with since you've been working there?
Hmm.
I mean, it would have to be loss of life. I get that.
I bet you've seen a lot just being there 10 years.
Yeah. Yeah, I definitely have seen a lot. But I mean, I guess
Maybe what is the most
Traumatic.
you know, without getting into details, what's the most maybe the unexpected thing that you've dealt with?
most unexpected. Y'all need to hang out with me for a day.
I
You-
kind of would like to watch. Another thing, I don't want to give too many details on this, but back when I was working in corrections, we had a guy that had to go be transported to one of the, I think it was university. Well, yeah, I think it was university. And he ended up needing to get his leg amputated, but he had a bunch of inherent health issues like blood clotting problems. And I remember they tried desperately, like all night, to keep him alive when they had to do that amputation. And they were, what do you call the little tool that they use to cauterize
a bovie?
a bovie?
Mm-hmm.
Well, I mean, they were, it almost sounded like electrical zaps when I could hear and smell them trying to cauterize his amputated leg. And they tried all night long to keep him alive, and he died like in the middle of the night. And even though I didn't know him that well, that was sad and traumatizing because it was like, man, he made it through the surgery. And they're just sitting there doing everything they can for him. It just seems crazy that you make it through that and then hours and hours and hours later you pass away.
Sure.
Um,
What do you think could have caused something like that?
I honestly, he's probably like if he had a lot of different stuff going on and he was having trouble clotting, he's probably in like DIC or something where his body just wasn't clotting like it should anymore because he was so
Yeah.
sick.
Yeah, I think it just came down to he just had multiple health issues and it just compounded on him, maybe.
Mm.
But it just, like I said, it seems strange for him to make it all the way through the surgery and hours and hours later in the night just randomly pass away.
Sure.
That I mean that probably is difficult, because we, you'll have people that come in that are critically ill and, you worry about them making it through the surgery and then they make it through the surgery and you think that they're, on the upswing and then, because of just the nature of their illness, they pass away and it's hard, because you're like, oh yes, we've got through the hard part,
Mhm.
and then you're
And
like,
I can
wait, what happened?
yeah, I was gonna say I can only imagine as somebody being in the operating room how frustrating that would be to think that somebody's gotten through something and then I don't know, next thing you know they're gone. But
Yeah, it's I mean, probably some of the heartbreaking stuff is, like we help somebody I mean, I've sat down and talked to people about their drug addiction. Like I'll get involved with a patient, probably because of a wound and then, they keep coming back and I get attached to my patients, especially the ones that I take care of for a long time. And, you see something bad happen in their life and then you see them get addicted to drugs and then you're like, look, Like, if you come back, like, if you leave and you don't make a decision to stay off of these drugs, if you do that, you're gonna die. Like,
Yeah.
you're killing your body, like, your kidneys aren't working the way that they should. You're killing yourself. And, to find out that, they may have overdosed or something like that, it's hard because it's like, well, I mean, could I have done something differently? Could I have explained something different to them? That can
And
be
I,
hard.
Yeah.
I think that most of them. I'm sorry, Kevin.
I don't know. I was just gonna say in that case, is at least in my opinion, it's not the least bit your fault because there are people out there, and I know some of them personally that they can know that something's killing them, and they're like, "Well, but I like it. I'm gonna keep doing it." You know?
Right. I was going to say most of them probably don't have to be told this is what's doing this.
Mhm.
I think that they probably are smart enough to put two and two together with that.
Yeah. I
Yeah.
mean, I know, but you're like, could I, and it's probably a prideful thing, to be honest. You're like, is there something else I could have said, just to, but y'all are right. It's not, addiction is something that's hard. You've got to kind of make that decision on your own to turn away from that.
Um, and we've done all this talking about surgery, and I think have you? I know you said you don't necessarily deal with uh pharmaceutical or prescription stuff all the time, but is that something that you sometimes have to do? Do you ever have to write
Oh,
prescriptions or
yeah, yeah, I
what?
definitely write prescriptions. I write antibiotics all day long, and obviously with surgery, I'll write pain medicine for our patients or post-op patients. But as far as like long-term like diabetes medicines or long-term high blood pressure medicine, I don't really do that because that requires further management. Like they need to have 3-month follow-ups, and then I'm getting into family medicine.
Yeah,
Dr. Jones picks at me sometimes because I do manage like short-term stuff. Like I'll have a patient that at one of our outside clinics that we go to. I'll have a patient that comes in and they're like seeing me for one thing, and I'm like, you don't you don't look too good today. What's wrong? They're like, oh, well, I mean, I've just like had this fever and this cough, and I'm like, okay, well, I think we probably need to get a flu and a COVID test on you. And so I'm like calling down to the lab, asking them to come down to the surgery clinic to do that. And they're gracious enough to come down and do it. And he's like, doing your family medicine, weren't you? And I was like, well, yeah, I got to take care of this patient.
speaking of COVID, what was it like having to deal with that while that was going on?
That, it was, initially it was kind of scary because like not necessarily, I'm kind of crazy about from that standpoint. I wasn't really worried about it for myself, but like, am I going to take this home to
Mhm.
Chris and make him sick? Like um,
How much am I going to spread it?
yeah, yeah, because when you didn't know how it was spread, they kind of had an idea, and then you had all these different theories of, oh, well, you can not have any symptoms at all and spread it. Then you're like, oh wow, like that's scary. That's not
One of
Yeah.
scary at
the
all.
one of the benefits of and I'm sorry for cutting you
You're
off,
okay.
but one of the benefits of having her there though was my mom got really bad and was in the hospital. I couldn't go see her, but Tammy could because we had her up here in the hospital where Tammy worked.
Mhm.
So that was one of the things that uh, I at least had somebody who could go check on her. And a lot of other
Yeah.
people didn't have that.
Yeah, no,
So
that was good. It was just a crazy time. I remember hearing that hospitals were over flooded and didn't have space for new incoming
It
patients, and
was a lot, like, the critical care folks, man, they were absolutely slammed. Like, from a surgery standpoint, they made us stop doing, surgery that was elective. So, if you had gallstones, but you weren't symptomatic and you just found out that you had them and you were planning to get rid of it because your gallbladder wasn't working right and you didn't want to run the risk of having pancreatitis or something, that would be elective because you weren't sick. And so the we were, told, hey, don't do those cases. You got a hernia. Is that hernia is not, dangerous as far as like getting stuck or with some bowel or colon in it, and causing, serious problems, then hey, you just kind of push that back in and
So critical
go.
cases is like all y'all were
That's all we were doing for a
able to
while.
deal with.
Yeah, that's all we could do for a while. And it was kind of like a balancing act because, you would have people that would come in and they were fine from a gallbladder standpoint. And, they had had a flare, a couple of weeks, a month ago, but they finally made it in to see you. And then you're like, okay, well, we can't do it right now. But if you start having any trouble, you let us know. Well, then that patient ends up in the ER because they're really sick having a flare, but then they don't want the patients in the ER because there's tons of COVID patients in the ER.
Yeah.
And they're like, okay, so, it's like if you think that your patient could potentially get sick, then it's okay to go ahead and do that. If they've kind of had some flares, then go ahead and schedule them. But
And
it
this
was a
kind of
balancing act.
situation, this kind of thing happens more often than not. This hadn't been just a few months ago. I was talking to her about that. Baptist was completely full. They didn't have a bed anywhere. And every now and then
It's a scary
there's
situation.
a flare up with patients having to go to the hospital, and that will happen. They'll be completely full.
Yeah, nothing to do with anything in particular, but just to be full.
Did y'all had y'all ever dealt with, like, say, a problem like that where the hospital's full and next thing you know somebody's flying in an emergency patient that got in a car wreck or something and is unable to receive care? Like,
Well,
have you
so
ever run into
a lot
that?
of times before they bring the patient, they'll call to the hospital and kind of say, okay, this is, what we have. And then, like if a hospital's on diversion, then they'll have to take it to another hospital. They do, check on that. But I don't think that no one would receive care. They would. There's been people that have had to stay in the PACU, and then the PACU nurses, bless their hearts, they're amazing people, would stay and be the nurse for that patient because.
And see, one of the things that's hard with places like University Medical Center is that they're the only trauma place of their kind in the state. So if you can't see them, you got to go to another state.
I was gonna say I've heard Mississippi needs more than what we have in terms of facility. Is that
It's
true?
probably every state.
Well,
But
so back to that whole professionalism that we talked about at the very beginning. So sometimes you may have the space in the hospital, but you don't have the staff to staff it.
Oh, okay.
And so, like, you may have a whole floor of the hospital that you could put patients, but if you don't have nurses to staff it, then you can't have patients.
Yeah.
Like you may even have
Makes sense.
providers to see them, but you still got to have the nurses to open the floor and take care of the patient.
So sometimes it's straight up staffing shortage and nurse
Sometimes.
shortage.
for instance, like burn specialists, there's very, very few of those too. In fact, do you still have?
We have Dr. Coleman is at our hospital, and then they're
But for that, there's very few of those around.
Like a burn center.
We had only one place in our state that's considered a burn center.
we may actually have two now. I think
Okay.
University has one, and I think Baptist has one.
But there are very few
Yeah.
few places you can go that for specialty treatment in burns.
Now, when you were burned, there was only one in the state, and
Yeah.
so it just happened to be at CMMC after you were burned.
But when you're looking for say care that's critical and you need it fast, and you have to go to another state, that's
That's a big
a big deal.
I was gonna say I felt like you talking about this. You must have had some sort of experience.
Yeah, but it's not.
Tell us what happened.
Well, I got burned, and I was putting some stuff on a fire, and flared out on me, and I got
Ooh.
burned and had to go to the hospital. But
Did you stop, drop, and roll, jump in a pool?
oh, I did. I remember every bit of it.
Jeez.
Watched that fire close around me where I couldn't see.
I'd have been panicking. Man.
Well, my first thought was to do that. You remember that from when you're a kid, but
We got
but then when you get it out, you've got to deal with what's left or what's not
Yeah.
left, and
so you had a full blown fire, or like you were literally on fire.
No, I was, yeah.
Jeez.
I had to. I was wearing some jogging type pants, like
like wind pants.
yeah, like that kind
That's
of
what
thing.
we'd
And
call back in the 80s.
I was trying to put my
Windsuit.
I was trying to get my phone to call Tammy, and I had pulled my pants down a little bit because they were on fire, you know,
Yeah.
and the mesh pocket was out, and I was trying to get into it, and I couldn't get into it because I couldn't get them turned back inside out. So I was just going to rip the mesh, and when I did, my skin peeled off like it was a glove, off of my hand, and it was pretty bad.
Was it your right
But
hand?
it was both
both.
arms,
Both?
and yeah,
But your
It's funny how
right was the worst.
this part was the worst. That's the part I lit the fire with.
Okay,
That was
so
the
your
worst.
left.
Yeah.
I don't even, and granted, I don't have my glasses on, but I've never noticed anything odd about your hands.
It did really well. My recovery was well. I mean, sometimes when I get cold or my skin gets cold, you can see little white patches where I guess where the skin grew back a little bit differently. Now I had
Did they like graft anything from
Yeah.
other parts of your?
not from my body. I had skin on from pigs,
Interesting.
and I
Okay.
had what was it? Just pig? Was it just
You
pig
had?
skin?
I think they put cadaver.
That's right. That's right.
they
Cadaver
put
skin
some
and pig
cadaver
skin. I had.
on you.
Now the part I had surgery the day after it happened, where they clean you up, they get all the other skin. That part to me, when I woke up from that hurt worse than the fire.
I was gonna
That-
say,
that-
I feel like that would be.
It was
I don't even
painful.
like to
It
think
was
about that.
because here's the thing. You can take pain medicine for that, but you have to wake up from the surgery. So
Mhm.
they make you wake up first before they give you pain medicine.
Yeah.
So it's kind of a balancing act with that
Yeah.
too. So when I woke up from that was painful.
Yeah. No, I mean, in my mind, I could be wrong, but to me, burning is one of the most severe forms of pain you could ever experience, I would think. I can't think of too many things that would hurt worse than burning.
It's the worst. It's the worst pain I've ever had. However, sometimes burning worse than I did is not as painful. It's the surgery,
After?
the recovery from it
Yeah.
is the worst part. To me, it was.
Well, what he's
But-
saying is people sometimes that are burned really bad, like you talk about like 4th-degree burns,
Mhm.
they don't, their nerve endings are burned too.
Oh, so they can't even feel it anymore.
So
Mm-mm.
sometimes they may not feel how severe it is.
But
Jeez.
that part, you know, you run into things like the worse it is, sometimes you don't recover from that, and you have to have body parts removed, that kind of thing, because there's not enough left to recover. You know.
Yeah.
Mm.
Oof. Yeah, I'm
In
glad-
fact, they tell you like I think they told her that did I have some 3rd degree? I think it was mainly 2nd degree.
I think I can't remember.
But anyway, I had the worst type for pain.
Yeah, he scared me. He scared me that day.
Did you have 2nd or 3rd degree, or like what?
I think it was mainly 2nd degree, and I think
Okay.
that's the worst as far as you're not getting into the nerve damage.
So you can fully feel
Yeah,
the
yeah,
high
right,
sensation on
right,
everything.
right.
Yeah. No,
But
that-
I mean, honestly, you want it to be as
For-
little damage as can be.
yeah, I mean, at least,
for recovery's sake,
yeah,
you know.
yeah. I was gonna say at least you can make a full recovery.
Oh yeah, yeah, yeah.
But I could, yeah, the pain, dealing with pain, especially if it went on for days, weeks, whatever.
And I'll tell you this, I spent was it one night or two?
You spent one night in the ICU and then one night in the hospital after your surgery.
Before I came home and I had that surgery. I rode an ambulance from Hattiesburg to here to the burn center. Had that surgery. Came home, and my bill was just over $100,000 for that. Now,
Yeah.
insurance was good. I was glad I had insurance. However, that's the cost, and that's, we were talking about that earlier. Now, I don't fault to a certain degree some things that have to be done, but $100,000 is a lot of money for
Yeah.
just for that accident that I had.
Well, I have to tell
And
you
we're
that
talking about, there's people. Go ahead. I'm sorry.
probably some of your skin subs that they put on
Oh, that's it. Yeah, I get
kind
that.
of
Yeah,
ran that
yeah.
up a little bit.
Yeah.
Hmm.
But And that was just for, now I'm not going to call it a minor burn. It was a major burn, but I mean, in the big scheme of things, that wasn't a huge thing.
You didn't have to have physical therapy
that
or
cost that
anything
much,
like that.
Yeah, when I was still in the military, I had a bad moment where I was running outside. It was like 100 and something degrees, and I collapsed, woke up in an ambulance, had to go to the hospital for like a week. And I remember them bringing me a bill for like 30 something thousand dollars. And I was like, I hope you don't think I can pay this because I can't. Yeah. And I was like, and this happened on base. Like, talk to Uncle Sam, man.
And that's why you're still working for the hospital today, right?
Yeah. No, but I remember it made me briefly go into panic mode a little bit because I was like,
oh yeah, yeah.
This. Yeah.
No, like medical bills can be overwhelming. Yeah.
It's like, how do you repossess this care that I just received?
It's like, we now take possession of you.
That's right. That's right.
You will sweep floors and I don't
That's
know.
right.
You're a voluntary servant now, or involuntary. But yeah, burning. That's something I hope. I mean, I've been burned a little bit, but to the extent of 2nd degree, 3rd degree, and so on, I hope I never experience that.
And it was, and that shows you the power of just pure heat like that, because from the time that it happened until the time that I was out, I mean, there was nothing happening, was probably, I mean, literally 3 or 4 seconds from the time that it happened until there was no more fire. But all of that happened that quick. 'Cause that heat, it makes small work of flesh very quickly. That's what you have to realize, that it's not, that I was just in it for 5 or 10 minutes. No, it happened in just a few seconds,
Yeah. Oof. Yeah, that's, I don't know, scary.
Yeah.
For sure. Have you ever had to deal with a burn victim or anything, or?
I have. Yeah. So we help with trauma at the hospital, and so when trauma a burn is a trauma, and so they call us to come down
Okay.
and kind of help with the first part of the exam, even though the burn team takes over and does most of it, but we're there just in case.
And every now and then, and we're in Jackson, right? Every now and then, they have to do surgery on gunshot wounds.
Oh yeah, I would.
So interesting story. We were called in for a gunshot, a trauma, and it was at CMMC when they were still open. And I parked in the doctor's parking, and I was walking in through the ER to get to the OR, and like the crime scene van was out there, like the person that had been shot like drove himself. Like the vehicle was all shot up, and like the crime scene investigators were there I was like, oh wow, this is crazy.
It's like out of a movie.
Yeah, like most of the time, like they come in by ambulance or somebody drops them. Like at this particular facility, they had trouble with them just dropping them off at the door and driving off. And so like, that's not every day that you get to see the gun like laid out there in the car and the actual vehicle there. I was like, oh wow, okay.
I feel like if I was that guy, I'd feel kind of cocky. I just survived the hit. Somebody shoots up your car and you drive yourself to the hospital.
And what's strange is, Tammy can speak to this, but it's crazy that, especially with something like a gunshot, you don't know what damage is there until you get in.
Yeah.
Till you don't know what's been hit. You don't know what has been damaged, what's been nicked, where they're bleeding. You don't know anything.
I mean, you have a general idea just by the imaging, because they'll do a CT. But sometimes you find some surprises in there.
Yeah, it does seem like a scary thing to deal with because, I mean, if you think about what a gunshot is, it's a little lump of metal that just tears through your
Sure.
Mhm.
And
bodies.
hope that didn't hit some vital organ
Yeah.
or,
Yeah, or internal bleeding that you can't stop.
Sure.
Yeah, I would think a lot could go wrong with that for sure. Yep, that's another one on my list that I hope I never get shot. That
Amen.
wouldn't be fun.
Amen.
And not to keep bringing up the Charlie Kirk thing, but man, anybody that watched that, Hollywood and film just doesn't give you an accurate representation of how horrific it is to
Sure.
get shot. When you actually see it happen, especially a higher caliber rifle or something, it's nasty. It's ugly. Creates a huge wound, or yeah, I've seen some
Well, you're not, it was emotionally challenging to me. I'm telling you, people were just not meant to, humans
Yeah.
were not meant to see things like that. It's
Yeah.
just not, you're not meant to deal with that because it's not supposed to happen,
Mhm. Yeah, no, you definitely have one of those like in the pit of your stomach type of
Oh, yeah.
feelings, and and I've been a hunter my whole life, so I've seen these types of gunshot wounds on animals and stuff, and
But a person is different.
yeah, oh yeah, a person's different, but not as much. There is a difference, but not as much as you think. It's still, even with animals, unless you're, I don't know, maybe a serial killer or a mass murderer,
Yeah.
you still are affected by it. But yeah, seeing that with Charlie was, a notch above, or I mean, it was rough. Yeah, but what if you had to? I don't remember if we asked this earlier, but if you had to point to like a single worst case that you had to deal with, what would you say that was? Or can you remember? Like in terms of like, I don't know, this guy's really bad. I don't know what we're gonna do.
Well, sometimes I know and I hope I'm not speaking out of turn for you, but sometimes they get in to do a surgery and she's had doctor tell her, we're just going to have to close up. We're not going to do any good. I mean, I know that that's probably,
Yep.
a disappointment.
Yeah, like probably like dealing with cancer, like
Yeah.
you have an idea like because there's a condition called carcinomatosis that people can have like in advanced stages of cancer, and that's where you have like little cancer implants all inside the abdomen, and you don't see that on CT. Like if you can, sometimes you can see that on CT, and if you can, then it's pretty advanced. But sometimes you get in and there's just small little implants, and um, you know, whatever surgery we had planned, usually we decide not to do it because if we do go ahead and do the surgery, then that could delay their treatment, and they need treatment first, and then we'll come back and do our part. You know that's not a horrible situation, but it's like, oh, they've got to go through a lot.
Thinking you're going to be able to help and then find out you can't.
Yeah.
The worst ones are the ones that you're like, we can't help. They can't, like, treatment's not going to help them. We just can't help that. That's
And you're having to
probably-
tell them because they didn't know it.
Mhm.
Yeah. This is a really big jump in topic again, but we spoke a little bit about prescriptions and stuff earlier.
Yeah.
Have you ever felt, or even if it's not you or your colleagues, have y'all ever felt like you were being pressured to push certain things, or
From a professional standpoint.
Yeah. No, because like I said, there's not really anything that I would do or prescribe that, like, nobody's ever come to me and like said you have to do this. I mean, like I mean,
We're going to say this drug is better or
yeah, I mean, I do have people that I like run into that may tell me that like they may try to push their service or their product or whatever, but I guess I'm just not easily bullied, so it
Yeah.
doesn't
No,
bother
it's
me. Like I don't feel like my job. I mean, I never feel like
that's a good thing.
my job is in jeopardy.
Yeah.
Because of that, and um, I don't really think that like you would have to be in I guess a different organization to, where somebody maybe getting a pushback or something to make you say, "Hey, you need to do this."
Yeah.
But fortunately, I may have people that come and talk to me about things, but I never feel like obligated to use their product, if that
Yeah.
makes any sense.
Felt like you've never felt like you haven't had a choice, in other words,
Right.
or
Or we're
yeah.
pressured into
Yeah.
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 Okay.
Like I'm very thankful for that. But I don't know.
I feel like she kind of has a buffer as well with uh having the doctor over her. That kind of helps too with that.
Yeah. Yeah, that so
Well, so there's people that could have pros and cons of standing on your own 2 feet as being a mid-level. Um, as a PA, um, and in the state of Mississippi as a nurse practitioner, you have to have a supervising provider, right? So that
mhm,
means that I have to have 10% of my charts have to be signed off on and reviewed by
doctor.
my supervising provider, which is Dr. Jones. I could see where some people could get into a situation where they may feel pressured by um, their supervising physician to do that. I am very fortunate in all the people that I work with are not that way at all, but I could see where, it could potentially be an issue, like a professional issue from that. But on the flip side of that, I was just talking about this yesterday with one of our students. Um, I love collaboration. Like I absolutely love it. I like having a supervising provider, and I've been very blessed with the provider that I work with. He's a Christian man, and we share a lot of the same values, and I am super thankful for that.
Yeah.
Because I
Yeah, I
mean,
could imagine every now and then somebody gets stuck with somebody that yeah, that may not be as ethical or
right,
moral and
right. And so, like, you could get yourself into a situation where you could feel that kind of pressure, but the Lord has like really blessed me in who I work for, and like the work situation that I'm in, because all of the providers that I work for are really good people.
Yeah, I hadn't had to go up there and set anybody straight or anything like
yeah.
that.
No, but they're all, you know, they want what's best for the patient. That's our main goal, is to help the patient get better.
Do this might be another hard one, but do doctors and or nurses ever receive uh additional like commission or anything like that from certain prescriptions or medication?
No, that's illegal.
Yeah.
Yeah, can't do that.
Yeah. Well,
I mean,
commission might not be the right.
like kickbacks.
Yeah. Well, I don't even know if that's the right term either.
They've brought some good hamburgers before, though.
Yeah. I mean, I don't know. I could have, there's all sorts of information out there nowadays, so you never know whether something you're reading is true or false sometimes. But
Oh, trust me, it happens. I
yeah,
know that it does. And there's people that get in trouble for it.
I was
But
gonna say I feel like I read something about sometimes doctors do get paid by pharmaceutical companies to prescribe certain things, or I don't know exactly how it works. I'm not saying it's
Well, like you can't get I mean, used to, like before all these like laws and rules came out, like they would like send them on like vacations, and so like there's a certain cap of like even like bringing lunch to a clinic to present your product. I mean, you can't go over a certain amount of money. It has to be like a learning thing, like a type of thing where they come in and they teach you about their product and what they have,
yeah,
and tell you about any changes or anything that's been made. And so like I don't really know a situation that would be legal for a provider to get paid
Yeah.
by a
I mean, that's a good thing.
pharmaceutical company.
Yeah,
Yeah.
that's what I was wanting to hear, but
Yeah.
just because you want to hear something doesn't mean that it's true and necessary.
Yeah, for sure.
Now, I don't know what it's referring to here. AI says, yes, doctors are allowed to be compensated by pharmaceutical companies, but there are strict laws and ethical guidelines to prevent conflicts of interest, especially concerning kickbacks for prescribing drugs.
Yeah. Like you can't get money or benefits from using
Kickback payments made to induce a doctor to prescribe a drug can be a felony.
So the only people that can financially benefit from kickbacks are Congress and Senate.
That's right.
Not a
Legally, that's right.
felony.
That's right.
Not a felony.
Yeah,
That's right.
you can't do this, but I can.
That's right.
Yeah, that's a problem. Well,
They're also the only people that can inside a trade.
yeah. Well, yeah, they get to do that and they get kickbacks. So yeah, it's I don't know, crazy. We've definitely got to figure out
Legal bribes.
Yeah.
That's right.
Yeah, I mean that's all it is ultimately. That the term that they use to try to downplay it is lobbying, but all lobbying is and at least in my mind is bribery.
That's right.
Well, trying to think if there's anybody got any other question. Hey, what time are we at, Jack?
1:45.
1:40. Oh, okay. Well, that was interesting. I've been looking forward to having some sort of medical perspective on the podcast. So appreciate you coming.
Well, of course. Thank y'all for having me.
Anybody got anything else? Questions or
I don't guess anything. What's for dinner?
Yeah.
I don't know.
All right. Well, I guess we're good.
Enjoyed it.